Hi.
Hi.
How can we help you?
I have an appointment to be set up for a CPAP.
Okay, and your name, please? Okay, let's just take a look here. Okay, so Lindsay, is 4500 Sprague Avenue still a good address for you?
Yep.
And Blue Cross Blue Shield is still your insurance?
Yep.
Okay, perfect. If I could just please have you fill this out for me and take a seat, and Wes, our respiratory therapist, will be right with you.
Okay, thank you.
Wes, Lindsay's here for her appointment.
Oh, thank you.
Yep.
I'll be right with you. Lindsay?
Yeah.
Good morning. I'm Wes Stevens, therapist.
Nice to meet you.
Nice to meet you. Get your own paperwork filled out?
Yeah.
All right, we'll turn it in up here to April.
Thank you.
April, thank you for your help.
Yes.
We'll go in here to the fitting room and. So Lindsay, has your doctor went over your sleep results at all with you? Did they explain
No.
anything?
No.
Okay,
I got a phone call from the nurse though that I just need a machine.
okay. How do you feel about that?
I personally don't think I need one.
Okay, all right. So I do have your sleep results right here from your doctor's office, but first of all, I want to go over that there are 3 types of sleep apnea. A lot of patients are on these machines and not really aware what type of apnea they have. So the first type of apnea is obstructive sleep apnea, and that's what most people, when you hear I'm on a CPAP, that's what they would have. And obstruction, as it sounds, is kind of a physical obstruction. Their tongue, their uvula, their soft palate kind of occludes the airway. So when they go to sleep, the muscles and tissue get flaccid and just closes down the airway. Oxygen levels drop, CO2 may go up, and there's some hormones and enzymes that are released in the body that can do some long-term harm to the body. The second type of apnea, which would be central apnea, is a little bit more rare. Probably only 12% of the population would have this, and this, during their sleep study, a majority of the events would kind of indicate they're coming from central, and it sounds serious. It's from the brainstem, but it's a dysregulation of the brainstem to be able to monitor the CO2 level. And this can be young people, old people. It could be from if you've ever had traumatic brain injury, if you've got congestive heart failure, if you've had any kind of surgery and you've been on post-opiates for more than 6 months, anything to do with high blood pressure, valves, any kind of effect to the circulatory system can sometimes affect that. Very, very easily treated, but it's a different treatment than this one. The third type, which is fairly rare, called complex or sleep emergent apnea, is when we put patients on some positive pressure. Sometimes they spur off some central events, and it would need a different type of machine too. This would probably be 8% of the world. The nice thing with the new technology of the new machines is we have the ability to differentiate between those 3 types of apnea. So with that said, these 3 types of apnea all kind of have the same baseline standard, which would be called apnea hypoxic index, or AHI. So apnea basically means that you're breathing only about 90% less than your normal tidal volume or normal breath, and that can be from 10 seconds up to 120 seconds. A hypopnea is you're breathing 30% of your tidal volume, but your oxygen level's dropping, usually over 4%. So if we add these 2 together, a normal, someone without any kind of apnea would be 5 apnea events per hour or below is normal. Children are a little bit different. Theirs are a little bit less depending on their age. But for adults, if we talk 18 and over, we like to have it 5 and below on apnea. Now also when we do the sleep study, we have 2 other parameters. We're looking at your oxygen level, which is measured in SpO2, and ideally we would like that to stay above 90, 99% of the night. And as everybody knows, oxygen is very important for all the cells in the body. And then the third thing we look at is your mean heart rate when you're sleeping. And ideally, when you sleep, your body kind of goes into a parasympathetic mode. It kind of slows down, everything kind of repairs itself, recuperates. So if this number is somewhat elevated, that can tell us sometimes that this has been going on for a while, or you may have some quite a bit of inflammation or some outflow problems, some work. The heart is working excessively hard at night for some type of reason. So again, the normals we look for is 5 and below on your apnea event. Oxygen should be above 90. Mean heart rate varies with age, medication. Ideally, you'd probably like it between 55 and 65 or 70. So those are the standards. So here is a copy of your sleep study. There are 2 types of sleep studies. You could have a home sleep study that you have, that you take home, do in the comfort of your house and bedroom. And then there is a hospital-based sleep study that is actually a little bit more complex. That's about 9 parameters. And sometimes insurance dictates whether it's home study or if it's hospital-based, and sometimes diagnosis. If you have some other health conditions, you may require one versus the other. So we will go over your results here on your home sleep study. So Lindsay, what we have here is your home sleep study, and remember from the results prior, we were talking about normal apnea is 5 events or less per hour is normal. During your study, you stopped breathing 93 times an hour. 93 is very severe. We classify these in 5 to 15 is mild, 16 to 30 is moderate, and 31 and above is severe. Remember, the second parameter we talked about is your oxygen level in a female your age should stay above 99% of the time. So you drop below 90% for 195 minutes, and you dropped all the way down to 67%. And the very last thing, again, was the mean heart rate. Your mean heart rate was 96, which is fairly high for a woman your age. Do you understand this or have any questions at all with this?
Yeah, well, how low did my oxygen go?
Your oxygen dropped down to 67%, and that's very difficult to do. But you stop breathing 93 times an hour, so when you stop breathing, you're not moving as much oxygen, and you are retaining carbon dioxide. So if we treat the apnea, we hope your oxygen level will improve. And the heart rate kind of surprised me, right? Because you look like do you exercise a lot?
I exercise a lot.
Okay.
I'm in pretty good shape.
Okay. So what's going on here is this is just a relative indication that your heart's working extremely hard at nighttime because your oxygen's so low. So the only reason that the heart beats at all is to extract oxygen to the tissues. That's it. There's no other purpose of the heart. So if your oxygen's low, your oxygen is going to drop down, your heart rate's going to go up. And so what this is telling me is this has probably been going on for some time. So the bad thing about all this is a lot of people do the exercise during the daytime, try to eat right, and at nighttime you're offsetting everything you did during the daytime with this. And basically the other things that are going on with this are every time that you stop breathing, at your AHI there, 93 times an hour. So just a demonstration. So if you fall asleep, your tongue kind of occludes the airway, your oxygen level drops, gets to a certain point, your CO2 goes up, and it kind of stimulates you where you have serotonin and dopamine are released, but also cortisol, glucose, renin are released in the bloodstream. So if we look at it on this paper here, what's happening every time you stop breathing is you release cortisol in your bloodstream. Cortisol is a stress hormone. It causes inflammation, and long-term effect of cortisol can cause plaque buildup on inside of the walls of the artery. The other thing that cortisol is known to do is during the gut, down in your gut where the immune system works, as soon as cortisol is released, it shuts down the blood flow from the gut, and all that blood is shunted up to your arms, your muscles, your heart, your brain, because it feels that the body's under attack. But the bad thing that happens is you shut down your immune system completely, almost when we're shunning this cortisol shunts the blood up there. Other things that happen, every time cortisol comes out, it brings its little friend glucose, because the body needs fuel because it feels it's under attack. You were releasing glucose into your bloodstream relatively 90 times an hour. As the glucose is circulating around, the insulin gets stimulated. Insulin takes that glucose, takes it to the liver, and stores it as fatty acid. It is believed now that it used to be an alcoholic fatty acid was the leading cause of liver dysfunction, but now non-alcoholic fatty liver, sleep apnea has a big component to play with that. The other things that happen are renin, and renin affects the kidneys, and also you have adrenaline or epinephrine, and it basically clamps down the vascular system, so the blood, your blood that's left, is very poorly oxygenated. So your blood sometimes is down in the 60s, so it's barely carrying any oxygen. And you've got the vessels are clamped down because of the cortisol and adrenaline. So at nighttime, a lot of people may have a little bit of burning in the chest, and they may mistake that as reflux. But sometimes that can actually be coronary angina, ischemia, because you're not getting enough blood flow to it, and it mimics, the symptoms are very, very similar. Have you had any events like that at all? Where you have any burning in the chest at all?
Actually, yeah.
Okay. How do you usually treat that?
I usually take a Tums.
Tums, okay. Does it go away after that usually?
Kinda, yeah.
Kinda, okay. So that's, with these results, that's something we want to keep an eye on. Just simple stuff. Keep the head of your head elevated. Don't eat, 3 to 4 hours before bedtime, so you don't get the reflux, if that's what's causing it. So does this what this leads to, again, is a poor immune system. It can lead to diabetes because you become resistant to the insulin, becomes resistant because you're overusing the sensitivity to it. And then also there is a lot of literature, women more so than men, when your oxygen level is dipping through the night like that, it's called micro desaturations. That seems to stimulate the serotonin and dopamine receptors. If that's doing that all night long, you have a low reserve of the feel-good hormones or serotonin, and so you could have some underlying, mood disorders, things like that. And we are going to give you some articles on everything we discussed here. Do you have any symptoms like that? The depression at all, or?
Yeah, I do have depression, and then I'm very tired during the day. Okay.
Do you take naps too, or?
Yeah.
Okay. So when we send you home with the CPAP, we want you to wear this for naps and bedtime, and then anytime you're fatigued during the day, you should be on your CPAP. Eventually, those naps, you won't need those because you have a sleep debt that you need to pay back to your body. This has been going on for a while. It won't correct itself overnight, but we can get on top of this. What we have here is we have our new machine. This is an S10 AirSense ResMed. Great machine, has multiple features. We're going to go over parts and pieces, and then we'll get a little bit more dive into some of the complexities of this machine. The first component here is your water chamber. This water chamber is for comfort only. It's not, you don't have to use it. Myself being on one for over 20 years, it is very comfortable, especially in the wintertime, to have that humidity. So we want to use distilled water only, and we'll fill it just under the max line here. In the morning, if there's any residue left, dump it out. Let's retop it to the max line, and then once a week we're going to clean this. So we can do it in the sink, just a little bit of 1 part vinegar, 3 parts water, or Ivory Dawn dish soap, some mild detergent soap that's not abrasive. We're going to go over next the filter. The filter on the cut. So now that you have the filter in here, about every 30 days you want to exchange the filter. We're going to set you up with 6 of these today. Doesn't matter which side goes up or down. Make sure when you do put it on your bedstand, or if you have a small table, you give it plenty of airflow on this side to entrain air. So a couple features on this. This connects to all the cell towers. You don't need to do any type of put it code in or anything, and it automatically sends the data to a lot of the sleep doctors in Iowa, Nebraska, all over the United States and the world, actually. We will get that data. If your doctor is not in the system, we can certainly have them get their information and give them access. And if they don't, in the meantime, we can certainly get them a copy of that over there for them. Mm-hmm. The nice thing is it does have a backup SD card here for data. So if any of the cell towers aren't working, or you happen to be down really in a low range where the signal can't be picked up, we'll always keep the data on the card here. And there are places, certainly in the United States and through the world, that we have to do that. The nice thing about the machine also is it's very compactable. If we go to the back, we're going to have a place where you put your tube. So this would be your tube, and this is a heated tube. You can have a standard tube, which would have same twos of the same connectors. This one has a heated anoid here to hook up to get the heat for it. So about on this tube for cleaning on this, we would want to clean this weekly also. And that can be done with a little drop of soap or some vinegar solution in water and do that. Sometimes I take mine in the shower. It is easier to do it. Very simple to hang it up there when I'm done with it. So weekly on that. You are okay to get this part wet here. Just make sure that this is nice and dry before you attach it to the machine there. So that goes right to the back there. And the nice thing about this, it kind of swivels to whatever side of the head of the bed you're on. So we will go over some of the settings here on this real quick. So your doctor has ordered an auto setting for you, and what that means is it's kind of a modified sleep study at home. Basically, it stays in a range of pressures, and then will go up as needed. When you stop breathing, it'll increase until it pushes that tissue back in your airway. Once we feel you breathing again, the machine comes back down. In order for this machine to work correctly, there cannot be any excessive leak at all, because the machine has a very difficult time differentiating between the leaking and you not breathing. The machine interprets it as having apnea. It will compensate for a small amount. When it gets up too big of a leak, the integrity of the air splint is completely lost. So to be simplistic, all CPAP really is a high-priced air splint. We never want you to come back down to a baseline. We kind of want to keep a nice comfortable cushion of air in the airway to kind of push back the tongue, the uvula, the soft tissue, even maybe some of the palate if there's some extra tissue up there. So turning it on and off is up on this button here. So we turn her on, and once it's on and it's fitted right, this is what you should hear. What do you hear?
Nothing.
So it's one of the quietest machines in the market. And the nice thing is the screen goes dark, so it doesn't wake up you or a partner if you have one. You can always scroll to it, and as we just alluded a little bit before, you're on auto mode from 5 to 20. So ideally, as we're sitting here and the mask is on and we don't have any type of leak at all, it should ideally not go above 5. It certainly could, maybe if if your neck was crooked a little bit, or you start to have a little bit of hypopnea, then it would go up gradually. But again, the the only way that this is going to be therapeutic is the mask leak has to be within normal range, and you have to wear it when you're asleep, whether it's nap or bedtime.
Okay.
So this turns it off. The other thing that you would need to do on this is is dial your temperature in. So we will go under my options. So as you toggle so Lindsay, on the machine here, wherever it's blue, we can kind of toggle the screen. We're going to go to options, and again, you can scroll down to temperature, tube temperature, and this can be numerous settings from 60 all the way up to 86. I typically recommend the patient, whatever your thermostat is. What is your thermostat at home usually set at?
Like 69.
69. So we keep it around there. And if the air is too cool or too warm, you have complete access to increase it or decrease it. Mm-hmm. So lock it in. The next one is your humidity. So you can go from 0 up to 8. I would say this time of year, typically around 4, it is warming up a little bit, but when it gets down, 20 below or so, I would go up maybe to 5. Now, the best tell is let's just start with the midpoint 4. If you go home and you get a little bit of moisture or condensation in your mask, you probably went a little bit high, maybe go back to 3. So there's really, you can't do anything wrong. The other thing on this, if I've had patients ask before, if they travel, do you have to use the humidifier? You don't have to, but this is like a pot on the stove. It's always heating up. So if you were going to use it without that, you really need to go into, and you need to go manual temperature, and you have to turn that off, and you need to go under the humidity level and turn that off. Then you could safely run that without water. Does that make sense?
Yeah.
Okay. So let's put you back on your settings that you wanted. 69 and 4. The other thing, and if you always want to go back to home, get you back to these 2 screens, is sleep report. Sleep report's important. You want to see how many hours of usage you had. You can how many events per hour you had. Mask seal, is your humidifier fine? The humidifier, that is kind of more so how you feel. And then you can look at the, some monthly data in here, and we're going to give you a download too. Every patient I set up, I'll send you a report or talk to you on the phone and go over it. And also there is My Air app where you can scan this with your phone. We can walk you through how to do that before you go if you'd like to get that set up. That way you kind of have the information too right at your hands. It's a nice system. Or we can call you and give you a more complex download of the therapy if you'd like to see it.
Sure.
Okay. Do you have any questions at all on any of this?
Yeah, I had a few. So
Okay.
I noticed there was a blue snowflake on top.
Good question. So that blue snowflake, after we turn her on and turn her off, we see it blinking there.
Mm-hmm.
That is, this has the technology that you still have a little bit of flow after you turn it off,
Yeah.
and that's designed just to kind of cool the machine down, make it work a little bit longer. Any other questions you can think of? We went over a lot today.
Just go over the water
Okay.
and how far to fill it up.
Okay, so that's a great question. Everybody's different. You should not run out of water
Okay.
within a night, depending on how long you're on it and what your settings are. But I would fill this up to the top here, and then whatever you have if you have any extra or leftover water in the morning, you want to dump that out.
Okay.
And then once a week, you want to do a nice clean on this. So that would be some Ivory Dawn dish soap, vinegar and water, 1 part vinegar, 3 parts water. Let it soak for about 10 minutes, rinse it, let it air dry. And then again, the tubing once a week also, every 30 days on the filter. The machine, be careful too with transporting, never have water in it while you're transporting it.
Okay.
We do encourage you to transport it if you take a nap downstairs, bring it down there. And then, back to the bedroom for nighttime, bring it up there. Just be mindful of the water in here. So Lindsay, like any insurances now, they really want to see that you're using this equipment, so you have to wear it and daily, and in order for them to pay for it. So the regulations for your insurance looks like that you have 90 days from today, and they look at 30-day blocks. So within the 30-day block, at least 21 of those days must be 4 hours or more. Now that 4 hours can be from you taking the nap time, or if you're just a little fatigued, listen to the radio and you think you may fall asleep, you can put it on, and then when you go to bed, you can put it on. So that's all cumulative. Now this machine, since it's worldwide, it records from noon to noon. So, but we're going to get all your data. We'll never lose any of the data. And then after you're compliant, you'll need to go see your doctor. And what that is, that's just a formality with insurance. We'll send the data over that you're compliant, and we want to make sure, the doctor, may check some other things, see how your blood sugars are doing, or how your mood is coming along, and see if that has improved. All along, we also have a compliance team that's behind the scenes watching you. So we have, the therapist, I'll be watching you from setting you up, and then we have the compliance team come in, and continually we have a digital program in AirView, can see if you're having problems with mask leak, if you're having problems with apnea, if you're just having problems tolerating it as far as duration. There's a lot of things that we can suggest and do to get you compliant. So by all means, don't give up. Call in if you have any questions. This has to be a teamwork effort between you, us in the doctor's office. We're all in this together. So Lindsay, we've went through a lot. We went through your history. We've went through some processes that go on in the body, the machine. The next part of the journey is the mask. And personally, I think this is the most important because the machine technology, it's there. It's very high tech. It all boils down to the mask that's on your face, and you're the one that has to sleep with it. So first of all, we're going to go over the 4 classes of mask, and then I'll kind of give you a little feedback on them, and then you kind of tell me, what you would like to do. I did see the type that when you took the facial scan, and we'll kind of compare them, and we'll see what's the best fit for you. So Lindsay, the first class of mask we have here is what's called the nasal pillows. So kind of as it implies, it has pillows here that come in multiple sizes, and we want them to fit kind of flush with the interior of the nares. So this mask, and it has exhalation ports over here to get rid of your carbon dioxide. Now this mask does not have anything covering the mouth, so this is really designed for a patient that's not a mouth breather, or if you had seasonal allergies or a deviated septum, if you have any kind of sinuses or inner ear disturbances, this mask is probably not the best for those type of conditions. So Lindsay, the second type of mask we have is what's called a nasal mask. So the first one is nasal pillows, as it kind of alludes to, pillows up in the nose. This is a nasal mask, basically kind of a little plunger for the nose. So this type of mask or category of mask can come in different sizes, shapes, colors, makers. But basically it's designed just to cover the nose. The difference between this mask and the first one is that other mask is laminar flow, so it's kind of a stream of flow. This is turbulent, same amount of pressure. This feels a little bit more comfortable because it's not all in a stream of air. Again, your mouth, you wouldn't want to be a mouth breather with this. If you were a mouth breather, some patients do chin strap that they could do with here to help that. It still can somewhat be sometimes uncomfortable if you have a sinus infection, rhinitis, any type of RSV, flu, COVID. These masks may be difficult wearing it during that period just because you're gonna have trouble keeping your mouth shut with the excess pressure. This is the third class of mask, and this is called a hybrid mask or a hybrid full face mask. And the reason is it's not covering as much up here. This was kind of designed for, there was a lot of people that may have been claustrophobic, but either through a bed partner or spouse were identified as a mouth breather. So it still covers your mouth and your nose, so we're kind of have a little bit more coverage than the first two. This is a nice mask if you stay up and read or watch TV, you can have your glasses on with it and things like that. If you sleep in a recliner, this is a real good mask for that also. And when you're sleeping in the bed, if you go to bed and you stay in a relatively same position, it's not a bad mask. This mask I have seen some incidences of this, and when people that are a little bit restless sleeping at night, we get a little bit of leak factor around the nose up there. So that would be the drawback on this. I think if you were a super restless sleeper, sometimes we do get a leak there. Not everyone. And then also, it depends on how good the fit is. There are, a couple different sizes of cushions that would go in here, but there are certainly more nose sizes than there are cushions. So it's not a great fit for everyone. This does have exhalation ports to get rid of your carbon dioxide, where you would never suffocate. Nice thing about this one also is it kind of has a quick release. So at nighttime, if you want to get up and go to the bathroom, you can take your tube off, turn your machine off, and then go safely, as long as you feel safe, that you can see and breathe through here, go to the bathroom. When you get done with the bathroom, you come back and you can just kind of transition right back into sleep. That way you don't have to put the mask back on and come back up to subarousal. So that's the third class of mask, called the hybrid mask. Our fourth class of mask is called the full face mask, and as it implies, it covers the full face. This one is really designed for if you are on maybe higher pressures, if you know that you're a mouth breather, have seasonal allergies, a deviated septum, ear infection and their ear problems. This one kind of distributes the pressure a little bit better than the other three. The nice thing about this one is, as the one prior, is it does have the quick release there. If you do want to go to the bathroom at nighttime, you can go to the bathroom, come back, and then transition back into sleep relatively easy. The nice thing is some of these machines or masks have come out with magnets, and those are really nice. Whereas you kind of, the Velcro is already preset. You may want to tighten a little bit each night if needed. An example would be if you had a real salty meal. Water is usually retained up in the fat pads of up in the jaws up here, so you may need a little bit tighter. The good way to test this is barely be able to get one finger in on each side, and that's probably the right tightness. The mask should come right below the bottom lip, not on the bottom lip, and it should ride right up here on the bridge of the nose, right about where your glasses would ride. So the nice thing about this particular mask is it's easy to put on, easy to come off. Morning time when you're ready to get up, just take the magnets loose, come right off, bring it over here, just go right to the sink with a little bit of some pre-fixed vinegar and water mixture or Ivory Dawn soap, a little mild soap, rinse off the oil, the secretion. Everybody this time of year has viral shedding with the COVID, so you want to wash that off real good every morning. Put it on a towel. You would come over, dump out your excess water in your water chamber, top that back off, you're out the door. So it's not really a lot of work. So those would be our four mask options. And then next here is we'll kind of decide what's right for you. So now, Lindsay, that we've went over all the 4 different types of mask, which one are you thinking? And I'm going to kind of line it up and kind of what the scan showed and kind of listening to you. What mask do you think would be right for you?
I'm thinking the full face mask because I notice I'm a restless sleeper.
Okay.
And then I also have congestion and allergies.
Good.
So the nasal one might not be a good fit.
That's really good. Yep, your report shows us that you did classify for an F20 or a Vitara. That was what it came back is with that information you gave us, and with my clinical expertise was we pulled together. I think that you would be much better in a full face mask. Next, I have two masks. You know, there are multiple masks out there. I want to show you the 2 best that I'm aware of at this time, and then we'll kind of talk about the pros and the cons of each one, and then we'll try one on and see how you feel. Okay. So this mask here that is the F20 AirFit. This is from ResMed, the same makers as that machine over there. And we went over this a little bit earlier, how easy it was to take off. Again, some of the nice components are the magnets come out quickly, out early in the morning, and for cleaning, nice and easy to come out. Clean this every morning, again with 1 part vinegar, 3 parts water, or some soapy antibacterial soap. Make sure that's nice and clean, rinse it off, towel dry it, you're ready to go. Headgear, I would say, depending on how oily your hair is, once a month with some mild soap. Let it air dry. Do not put it in the dryer because the Velcro straps will wear those out. So this is one of probably our best selling mask, full face one. This is our other full face mask that's very popular, called the Vitara full face mask, made by Fisher Paykel. It's a different maker of that mask. This one is really nice. We'll do the exact same job as this mask. This one does do probably a little better job on somebody if they have a lot of facial hair, the men with the beards. And then also there are some machines that have higher pressures. This does a better job of sealing on that typically. It doesn't have the magnets, but it is fairly easy to remove the straps. Again, same process. Clean this every morning. 1 part vinegar, 3 parts water, or a little bit of Ivory Dawn dish soap. Very simple. Put it on a towel, let it air dry, you're ready to go. So those would be your two main options that are very, very popular, very successful. Which one would you like to try?
I think I want to try that one.
Okay. You want to go for the F20? So what we will do is are going to measure your face and make sure that we have the correct size mask. So what we're going to do next is we're going to measure your face. Every mask that's on the market should always be measured for, because each maker has a little bit different nuances with each mask. So we're going to go ahead and measure your face here. We look at the bridge of the nose, down right to the bottom of her lip. And Lindsay is a small, and you fell right in that range is a perfect fit. So I'm going to go back to the warehouse, and I'm going to get a small, and then we're going to go ahead and put you on a machine, see how you do. So we measured for a small AirFit F20 by ResMed. We're going to go ahead and put your mask on here. And I like to kind of take the valve off here. That way you have plenty, you can breathe plenty until we get you ready to go. So, and we're going to put you right there and just right under the bottom lip there. Come around. And we don't put you on excessively tight to start with. We don't want to run you out of town, but we kind of want it a little bit tight. How you doing in there? Okay.
Yep.
Okay. So what we also like to do is I like to look at your heart rate when we're doing this, just make sure everything's okay. So we're not doing any kind of diagnosing. We just look at your heart rate and make sure that you're tolerating the pressure okay. So we've got a baseline of 97 and a heart rate of 84. So we'll leave it on there, and then now we're going to put you a little pressure and see how you do, see how everything tolerates.
Okay.
Sound good?
Yep.
All right, let's do it. We're going to go ahead and hook you up to the pressure now. So I just want you to breathe normal. We're going to put that on there. I'm going to send just a little pressure through there. I want you to breathe normal. And you hear that little pop sound, that pop? That's IQ intelligence. So that tells us that mask is appropriately fit for your face. So I just want you to breathe normal. We're kind of, we're monitoring your heart, make sure that looks great. So we're staying right there, right where we started. What we want to do is why we have that on, I want to go over some of for insurance purposes, your mask. This is your exact mask, but mask for billing for insurances, we have three components of that. We have a headgear that you can have insurance. We'll typically pay for a headgear every 6 months, a frame and a cushion every 3, and then the insurance on a full face mask would allow for 1 cushion a month. If you had a nasal mask or nasal pillows, they will do 2 cushions a month or 2 pillows a month. So, and you can get that. We have a company, Snap, that will send that out to you automatically, or you can always come into a store. I would call first and make sure that you're eligible. Hypothetically, if something broke before that period, we would sell everything for cash, a little bit cheaper to kind of help you out if you needed to. The tubing on here, a tubing you're allowed every 3 months for a tubing, water chamber every 6 months, and then filter, we get 2 filters a month. We're gonna go ahead and send you home with 3 packs today, and we're gonna send you home, if that mask is correct for you, we're gonna send you home with 3 extra cushions. So from an insurance purpose, you've got everything you need for 90 days. You shouldn't need anything else. So the main thing is that you do your part by wearing it and notify us if there's any problems. We're going to be watching you. I will. The compliance team, we're going to be watching you from the back end. And then also the doctor, your doctor has access to your machine also, as I did look it up, and they're in part of our program too. So the machine has a 2-year warranty. Everything's covered other than water damage. So do not transport with water in it. They're a reliable machine, doing this business for 30 years. These machines typically last anywhere from 2 to 9 years, depending on how well you take care of them. And a lot of that is not transporting it with water, and make sure that you religiously change out the air cushions in here monthly as needed. And how are you feeling?
Oh, good.
Doing okay? Your oxygen's up to 99%, which is, we're not making any diagnosis here, but that's as high as you can get without oxygen. So you're ventilating better than you are. Your heart rate has dropped 15 beats. So what that tells me is that you're very positive for therapy. We've raised the oxygen level. We've splinted the airway. We don't only want to splint it up here. We need to go down here and splint it where the alveoli are. Because if we have a leak in that mask, we may get some of the apnea here. We will never splint the airway down here. So remember, we're working on 3 processes here: apnea, oxygen, and heart. We want it. All 3 of those are kind of in an orchestra together. We want to make those live longer. So the best way to look at this type, yours values were relatively pretty severe. So, you know, the thing that's really helping you out is you're young, you caught it when you were young. But hypothetically, if you had a twin brother or sister and we put you on CPAP and them not, if we go down the road 5 years, the difference is your car is only going to have 10,000 miles on it. The twin that didn't wear the CPAP is going to have 50,000 miles. So this, a lot of people worry about maintenance of their car, maintenance of their house, their furnace filters. This is a maintenance of your body. And this is why this is a great product. I've been on one for a long time. I don't take any medication. It's keeps me very active, and I just wouldn't be without it. So we're gonna leave that on for a minute or two, and then what we'll do is we'll kind of go over some of the paperwork. We have everything on a tablet. We're gonna have you go ahead and we'll just have you sign that digitally. It'll send all the information. Everything that we talked about today will be there. I'm gonna send you home with all these articles. I have articles from the Mayo Clinic, Cleveland Clinic, Johns Hopkins, Harvard, and it's all articles explaining what untreated sleep apnea can do to your body. High blood pressure, diabetes, depression. It can cause memory dysfunctions, long-term uncontrollable atrial fibrillation, and ultimately heart attack or death. So it is very important to wear this every day, nap time, bedtime, and if you're fatigued. Call the store if you have any questions. And you're doing amazing here. Your heart rate's down. Now it's dropped down about 19 beats. So we're taking all that work off the heart. You're back. Basically, we just roll back some miles on your car. So this is absolutely fantastic. So if you have any questions, reach out. There is no stupid questions. Give us a call. We'd be glad to help you.